Over to KUAM TV 11, 726. Let's get Dr. Hoa Nguyen of the Governor's Physicians Advisory Group. Good morning, Doc.
Good morning, Chris. Good morning, Sabrina.
Everything okay? I know you said you had a rough morning. Is that something we can talk about, or is it more on the...
No, it's on the patient side, so that's okay. Something cares now.
So I guess just first of all, what did you make? We had the pilot program this weekend. They made a big to-do about testing as many people as we could.
Well, I think the goal was 100. That was the sample size, and then it ended up being 52.
Yes, I mean, the pilot program, like I say, it's a pilot program. They learned a lot out of it, and we're going to talk about it on Tuesday. But, the turnout is not as expected to be. So they have to go back to the drawing board and see how we're going to approach this in a different way.
Why do you think the turnout was low?
I'm not quite sure, Sabrina. I mean, there's a lot of factors, to let people know that there's the pilot program in that area. It's all about let the word out there for people to be aware of, ahead of time.
Well, they canvassed the area. They went door to door.
Yeah, but I mean, promotional-wise, you basically stood this thing up 2 days before you kicked it off.
Yeah, it's very hard. It's like when we go do medical mission in the Philippines. I mean, you have to have a very good promotional thing a week or two ahead of time.
Right. You need a jingle. You need some flyers. You need some ads.
2 days ahead, and you have to go door to door and knock at their door. It's not going to work. It's really have to be well planned ahead of time. So, like I said, it's a pilot, the first of its kind. So they're going to need to go back to the drawing board and see what's going on there. So they have to do better next time.
Do you think maybe perhaps people just weren't sick in the area? Because that was the requisite, right? You had to have these COVID-19 symptoms in order to get tested, and then they gave you a pass, right?
Well, they a little bit from input from yesterday meeting, but we didn't talk about this thing yesterday. But people are scared, and some people don't want to come out of the house, so and they don't want to go there to get tested. So and they do go door to door, but like I say, that's another one that we're going to try to figure it out, how to test them voluntarily. But people don't want to get out of the house because they're so scared. We got to approach it a different way somehow.
Well, Dr. Shea last week, he had mentioned why are we going out into the community and asking people to come out of their houses and come to the testing sites? Why, if you're going to go there anyway, why not do the test while you're there? Is that part of the discussions you guys had?
You mean do it at their house?
I guess Dr. Shea saying, hey, you're already in their house. Why don't you just, hey, how do you feel? Hey, by the way, can I just swab you?
Yeah, it's the tech. You got to protect the healthcare worker due to swab, and you can't really walk around full PPE from one house to the next. It's very common. You don't wear your street clothes and go up and swab somebody or test someone. You kind of expose yourself. So, in order to do the testing, you got to protect yourself. So, like I said, the people that go door to door, they wear masks and gloves and everything, but they cannot wear the full PPE to do that.
Doc, so if we didn't really execute this pilot program as good as we could have, can we still have faith in the results?
The results there, we have to take what it is. So, all negative, which is excellent, So, like I said, we'd like to have more, so to give you a better picture of what the prevalence of the virus in the community. So we like to have it more, and like I said, they're going to go back to the drawing board and figure what's going on. No, we haven't have a meeting for this one yet. We will talk about it tomorrow.
Okay. Are you aware, because the numbers we got was the 52 that were tested, and these were only the ones that came through the drive-through and walk-in. Are you aware if anyone was fit into the category of homebound?
I don't think so. I don't think so. I don't have the data from public health yet. Like I said, I'm going to ask, Dr. Montgomery to give a little bit of a talk tomorrow at the meeting, so we find out more and we we try to give her some input tomorrow, but not yet.
Let me ask you, Doc. So obviously, the governor is, I think she's putting out the recovery plan, what we hear today. But in doing that, she said that they would need some, I guess, milestones, for lack of a better word, like, 2 weeks of declining cases, or, a certain amount of time of zero positives. That being said, do you think that if we weren't to do any more community pilot program testing, that they could hold up this Estumbo and be like, oh, yeah, we're good, we did a little sample size, let's go ahead and reopen the island? Or do you think the prudent thing would be to maybe do some more outreach testing in some of these other locations that they've talked about?
Yeah, we don't want to have that resort and say, put our guard down and say that's enough to start to open things up. And she have a very tough decision there. And, we, like I said, we don't really know what the true prevalence here in the local community yet. So, we have to set some milestones to before we open some business, and we're going to open, I think, in phase. So we review the plan and give some comment yesterday, and she will review it, and then she makes a decision from there. But everyone want to be open. We want everyone to be open, but we got to do in stage with some caution. We don't want this thing to come back again as a second wave.
Right. So I just did the math here. The number of people that we've tested, at least on our side, is 1,387.
Yeah, our 160,000 people in Guam, so it's not the true representative of what's going on out there.
So you say even though we've been getting these zero positives, there was a couple cases over the last week, we've now got, the whatever, how many zero positives is still, but you're saying even with all that, we still don't know how prevalent the spread of COVID is on Guam.
I think just like a week or two ago, and I say, this past weekend is kind of a marker for me at least, because the 2 weeks ago is the weekend, right?
Right.
So, and we don't see that much of a surge. I'm still waiting for some lab tests to come back from some testing we did last week, and if the majority of those are negative, then God bless, we are doing very good, and then she can look at those data and then make up her mind of what business and when to open, right? But we don't see that big surge after 2 weeks of Easter. So I think Guam, we are in very good shape. We just don't want to look at it and say, hey, we're in good shape, let's put everything back to normal, and then we might get ourselves in trouble again. Like I said, we might, so we have to be cautious on it.
Last week there was a full push to discuss the new expanded phase of testing where people who are feeling sick or have COVID symptoms need to get tested immediately. Have you seen any sort of increase in people that have been wanting to come in to any of the clinics or anything like that, or calls?
We're going to get updates on the clinic status tomorrow, but as of AMC, we test more this past 3 to 4 days than before. So we send most of our tests to DOS lab. So those they run locally. So we're gonna get the results sometime this week, and let's see how the number go.
Mm-hmm. I did want to ask you about something, because there's an incident that happened at the speaker's office, and it was with regard to an employee. According to their press release, the employee's physician let this person know that they had tested positive, but then the results, or presumably tested positive, they had to send the results to Hawaii for confirmation, even after the physician had said that the employee had tested positive. Is that typically how it goes, that a doctor can say, oh, you tested positive, and then, well, you got to go get tested again, and it has to be sent to DLS?
No. It's once you're presumably positive, DOS take the extra step and send it to Hawaii for confirmation. But when you're presumably positive, most likely you'll be positive.
Okay.
So they have to take precaution even before the confirmation test just to make sure that they prepare themselves, to make sure that they don't, because their office, they handle lots of paperwork and a lot of visits from other people come in and out, and they had to take precaution ahead of time before the confirmation test comes back, in order to try to prevent spreading the virus. Most of the time, presumably positive, yeah, they're going to be positive. There's no question
And
about
so,
it.
Doc, can you just give us a little behind the scenes on that? When you say presumably positive and then a probable case, what type of examination does the doctor perform on the patient to reach that determination?
Oh, no, that's from the test wise, Chris. It's not for examination. When the patient comes in complaining of certain symptom, and then the physician will decide to test and not to test.
Okay.
And so it's not through the exam, it's through mostly from the symptom, and when you talk to patients or the vital signs, and they decide to test, and like I said, presuming positive mean that, like I say, you got to take precautions, when the test come back, hopefully today, we should know today or tomorrow is confirmed, and most likely it will be confirmed.
Mm-hmm.
But like I say, the speaker have to take action before that, just to,
Right.
to make sure that everyone's safe.
I just got a message from her chief of staff. He says, because we were trying to get her to call in this morning, he says the speaker wants everyone to get tested first. Her main priority is the health of our staff, and we are all on our way to get tested now.
Mm-hmm.
Yes. So that's the right thing to do.
Mm-hmm.
Okay.
So presumably positive, are they classified as PUIs for now? Is that
Right now, I don't think they count as positive yet.
no? But are they counted as PUIs?
Yes.
That's what they would be classified as.
So the person will be quarantined at home, and until this test coming back through Hawaii. But right now, the person stay at home.
Does anybody keep account on PUIs?
I'm not quite sure. They keep account of PUI, but if the patient come in and complain of some symptom, and you test them, it will be we'll say that's a PUI. A lot of people that come in because they have come in contact with them and don't have any symptom, I don't think they count as PUI. But so you can say PUI, so everyone that turned positive, and some negative, but I don't think they count them.
Doc, I know you'd been saying that 2 weeks after Easter was going to be a kind of a gauge to see where we're at. But I'm wondering, outside of the pilot program at Estumbo, how much testing for COVID do you think was done over this maybe Friday, Saturday?
I'm not sure. Our clinic, I said, we swapped on Saturday about 20 plus on Saturday. So I'm not sure what the other clinic are doing. I mean, it's open out to all the clinic now. I mean,
right,
there's a word out there that anyone that like to test, they can call the physician, and if the physician office determination to see is that they want to do at their clinic or they want to refer to a tier 2. Some clinic either their office space or whatever reason is not, if they deem not safe to do it, then they won't do it. It's they have the ability to do that, protect their staff. So if the clinic feel that they cannot do safely, then they will refer to other site to do the testing.
We had a comment here. I mean, I've seen this a few times, but they were saying testing done on a hot day like that. Are we at all concerned about the integrity of the samples, or do they kind of have that covered?
No, that type of cover, because once you test it goes straight into the valve, so it's not exposed to the air very long. You don't walk around with that swab. You put inside the valve right away.
Mm-hmm.
Okay.
And it's really depend on you got to do the test correctly too. That's where I don't know is really based on the you or the person to do the testing.
Right. Doc, we had you on last week, and there's a comment from Vivian. It says, Doc Hoa, you said the test is free, but Linda DeNorsi says it's not free. How can you explain that? Times are hard. People do not have the money to pay to get tested. Plus, a lot of us no longer have medical insurance to cover for the tests or to get maintenance checkups.
I'm not quite sure. I think they misunderstand Linda. I tell you 100%, nobody should charge for testing. 100%. I mean, that should totally be free to the patient. I think they misunderstand Linda. That the tests are free. You know, if the patient pays $0 for testing. If the patient has to pay something, they gotta call in and tell us what site they go to, who they go to. But I tell you, they should charge $0 for testing.
So if I needed to go to the doctor and I requested testing, I wouldn't have to pay.
$0, Sabrina. You pay nothing. Yeah, even you have insurance, your copay is $0.
Mm-hmm.
You know, you come out of the office or anywhere, you shouldn't spend 1 penny on it.
Okay.
Is that just because Dr. Hoa says, or is that what is written down?
No. That is something that advisory board are very firm on it. Nobody.
Alakazam, Alakari, all COVID-19 tests are free.
Yeah, I tell you, and if the patient gets charged, please let us know. I mean, they should not get charged at all. I mean, the tests are, they shouldn't cost anything when to do this thing. It's a community thing. It's not like, you get sick because something. This is involve everybody.
It's a public health emergency. I got it.
Yeah, I'm very sure that they misunderstand Linda regarding to pay for the testing.
Doc, there was another comment here from what I was told from a person who was tested. It hurts due to swab being inserted far into your nasal cavity. Is there a possibility that the test wasn't given correctly? Just asking.
No, the test is not comfortable, guys. I mean, it's uncomfortable. I apologize ahead of time to everybody that I'm going to test.
Right.
Because it's not comfortable. You have to go pretty far up there to get the test done. And, I wish there's other way. There's saliva test, but it's not really very widely available yet, But no, it's not a very, very comfortable test. So if you don't feel nothing, that means they didn't go far enough up there.
Oh, so look up to your eyeballs or something.
Yeah, it hurts. I got swabbed over at AMC in McGeelau for some B-roll. This is kind of like a few weeks ago. So Nurse Francis had given me a swab, and it did not feel good. So yes, they're doing it right.
Is it both nostrils?
No, it's just the one.
Just one.
But they go way up into the gold mine.
For this one, you gotta do both.
Yeah.
Oh, you do?
Oh, you gotta do both. Ow.
Yeah, you gotta do both for this one, Chris. Guys.
But it's not like a prostate or nothing like that. It's just a little sticking in there.
Yeah, it's kind of hard. It's not painful. It's just uncomfortable, and you feel like you go up your brain or somewhere. But
when you get punched in the nose and you kind of get that little tearing up a little bit, it's almost like that.
Never got punched in the nose.
Yeah,
Lucky you.
Okay. But again, guys, it's free, okay? It doesn't cost anything.
Okay, Doc.
Okay.
So how you feeling, though, Doc, about this? I mean, because, people are just, over the weekend, I went out, I drove around. I wanted to take my kids to the beach for a little mental and physical exercise. Pulled up at the beach. There were canopies set up. There were people gathering. There were about 20 to 30 cars. And this is a little beach. So I think people are hearing... And they're putting it together that other governors talking about recovery. We're getting zero positives. So people, I feel like, are just letting their guard down. I'm not, though. I'm not. Yeah. We're not.
And that's what we are very cautiously put a message out there. Please, still practice social distancing. Wear your mask. And if you really love your loved one, you have to take precaution because, all we need is one, and you might lose your loved one. And you gotta be cautious. This one, we see the number going down, but the new norm, just like the recovery phase, everything gonna be different. You know, the social distancing is very important. The mask use very important. So, you know, we know that the disease spread by cluster mean that group of people get together. I mean, it's not really something that require rock scientists to do this thing. You know, it's all documented. So, anytime that you have gathered 20, 30 people, you barbecue together, there's a possibility one of those persons that have no symptom or carry the virus is going to hurt your loved one. So be careful. You know, you need to exercise cautiously and not let your guard down.
Thank you, Doc, for saying that.
Yeah. Okay.
All right. Appreciate it.
Can you also just before we mute you, can you just make sure it's absolutely clear that you are not prescribing Clorox pills or Lysol shots?
Yeah, can we just get a comment on that about ingesting disinfectants? It's wrong, right? Don't do it.
It's totally wrong. I think President Trump. I think he feel bad about it. It's just no. Truly, you cannot do that. Those are excellent use, and even external use is really be cautiously used, but do not drink any Clorox or Lysol or inject anything, because I tell you those things are very caustic, and you can die from it. So please don't do that. Yeah.
All right.
But if you die from it, you won't get COVID. So.
True.
I mean, I don't even know what world we're living in, Doc. That
we're just kidding.
Yeah. Yeah.
Bree was like, "Hey, you want a little Lysol in that coffee? Just a little hit."
It's good, but seriously, the new norm going forward probably the use of masks. You know, it's the new norm for a long, long time. And you know, what happened is that what we are afraid is that during the flu season we're coming up in September, October, and that this might come back along with the flu.
Mm-hmm.
So that's what we're afraid of.
Okay. Well, thank you so much. As always, it's a pleasure to hear from you.
Right. Appreciate it, Doc. Wash your hands, Kay.
Okay. Stay safe, guys.
Yeah, we will. Okay.
Have a good morning.
There you go, Dr. Hoa from the AMC family of clinics. He's also on the Governor's Physicians Advisory Board. And the important word coming out from Dr. Hoa.